Hi, thank you for joining us for today's topic on association health plans. My name is Mike Dillon with Dillon Health, and I'm the CEO, and I'm an employee benefits broker who's licensed in all 50 states and the District of Columbia. This summer, the Department of Labor issued a final rule on association health plans, or what's often referred to as AHPs, AHPs, standing for Association Health Plans. Basically, what they have said is that small employers now can join together and form for the primary purpose of health insurance to get cheaper rates. They can also allow for sole proprietors to join these association health plans as well. They can do it by industry across the country, or they could do it for any industry within a region. Which can be statewide. It could be a metro area that could include outside of state lines. But for the most purposes, it's going to be in an industry. They did also allow for companies to set up under the previous rules and allowed existing association health plans to continue under the old rules, which really required them to be more of a bona fide trade association for the purposes other than health insurance. Usually, those groups are put together for advocacy type purposes for a certain industry. And so those rules still apply, and what they do allow is for those groups to do underwriting, where the new plans basically do not have any underwriting. They're going to have to set rates for every group that is able to join those associations. So there's going to be benefits to going either route. We've been involved with association health plans for over 20 years, running them, advising them, helping them put them together for these associations, and working with insurance carriers to come up with for long-term successful programs, not looking for short-term gains. So we kind of know the pitfalls and what to look for and what things might help. But there are opportunities for employers, associations, employers, families, and their employees to come up with different options that are more affordable, and we're excited about what these may bring. It is important to understand the nuances of working with the carrier and the broker community to make sure that these programs are successful for everyone involved, meaning the association, the employer, the employees and their families, and their advisors or their brokers. So on our website, there is links to the original executive order by President Trump, the Department of Labor's initial ruling, and then the final rule is on there. And then we actually had some comments that we provided to the Department of Labor that are on their website, and those are listed down below on this blog post as well. We look forward to coming back on our next segment with more on association health plans on frequently asked questions. So with that, please check us out here at Dillon Health, www.dillonhealth.com. If you have any questions or need any advice or direction, we are always here to help and look forward to working with you as the healthcare reform experts for employers and associations. Again, Mike Dillon here. And thank you for your time and for joining us, and look forward to seeing you in our next segment.